Welcome to all of the people who are joining us in the webinar 175 since the Andean Health Organization, Convenio Hipólito Unanue, started the cycle of webinars in May 2020. It is 3 years of continuous interlearning. The COVID-19 pandemic also taught us that the capacities built and strengthened in these 3 years must not be rolled back, and health must remain at the center of policies. Research, epidemiological and genomic surveillance, vaccine and drug development, and the deployment of health promotion and prevention measures are essential for a caring society. Reflections on these and other priorities relevant to health and well-being can be found in the monthly NotiSalud Andinas newsletter, which is available on the Andean Health Organization's website. You are all invited to leave your name, your organization, and country in the comment box of the Facebook chat or YouTube Live. In that same space, you can leave your questions or send them via email to webinarhorasconu@gmail.com. To access the certificate of attendance, you will find in the Facebook or YouTube live chats a fixed link. Please fill out the short survey and leave your email. And please verify that your email is spelled correctly to send the corresponding certificate, which will be sent in the coming days to your email. In this webinar, we will follow the usual dynamics. We will start with the institutional greeting, then we will have the lectures of our speakers, and finally, we will move on to the question and answer session. At the beginning of this important meeting, I will give the floor to Dr. Marisela Malqui Osorio, which is the Assistant Secretary of the organization, who will give the welcome and institutional greeting. Thank you very much. I think that Dr. Calle is here already. Mari Carmen, are you there? Yes, Dr. Calle, welcome. Our Executive Secretary of Horas Conu.
Está con el micrófono cerrado.
Your mic is muted.
Hola.
Hello?
Buenos días, ustedes están de tarde. Buenas tardes.
Yes, hello.
¿Tocaba las palabras justo?
Sí, ya estamos en las palabras.
Yes, we are already in the welcome speech.
Marisela ya comenzó, bueno, pues.
So if Marisela has already started, we have not started yet. So we are just about to open the event. Okay, so
A veces hay problemas en la conexión.
sometimes there are problems with the connection. So if I have problems, I'm sorry, but this, you know, this is how it is, unfortunately.
Parte de
It's part.
de la interconectividad.
It's part of it being interconnected. Well, hello and good afternoon to you all, to all the people who today on May 25th are joining us in this 175th webinar. Since we started our webinar cycles on May 7 and 2020, we want to highlight with this webinar called Road Safety in Latin America, Challenges and Opportunities to Achieve Global Goals, the actions that are being developed within the framework of the 7th United Nations Global Road Safety Week, which was held from May 15 to 21 of this year. And since 2007, the General Assembly of the United Nations has delegated to the World Health Organization and the UN regional commissions the planning and periodic organization of global road safety weeks. This year's theme is Rethinking Mobility, which aim is to encourage sustainable transportation, the promotion of walking, cycling, or public transport over other means. They seek to raise awareness and lead us to reflect on how we move and rethink the way we do it every day to build safer and friendlier cities with the planet, and also encourage mobility for better health and quality of life. It is actually a paradigm shift that begins and ends with road safety. Road traffic injuries are one of the leading causes of death and disability in the whole world. According to the World Health Organization, approximately 1.3 million people die each year worldwide as a result of road crashes, and between 20 and 50 million people suffer non-fatal injuries, with a proportion of these suffering some sort of permanent disability. They are the leading cause of death among children and young people aged 5 to 29 years of age. Pedestrians and cyclists account for 1 in 4 of all road traffic fatalities. The Global Plan for the Decade of Action for Road Safety 2021-2030 has an ambitious goal to reduce road traffic deaths and injuries by 50% by 2030. To prevent them, the plan proposes addressing the entire transport infrastructure and also adopting measures to ensure the safety of roads, of vehicles, and road behavior, as well as improving emergency care. As international organizations point out, road crashes and their consequences are avoidable if the determinants are properly addressed, including the human factor, which is mainly associated with the unsafe behavior of road users. So, to modify these behaviors, the organizations stress the importance of establishing precise rules on expected safe behaviors, control and enforcement systems, which are effective and legitimate, and also actions aimed at raising awareness and educating road users. Historically, one of the reasons for public health indifference to road traffic injuries was the traditional view that collisions and resulting injuries were due to chance and only happened to others, but not to oneself. Such events were seen. I'm sorry, but the audio is quite choppy now. It's cutting out. As consequences, which is why they are commonly referred to as traffic accidents. Motorized vehicles enable the fast and efficient transportation of people and cargo. Vehicles are generally considered to have contributed to the economic and social development of societies. However, these achievements have not come without costs, particularly to human health. Well, in general, pedestrians, cyclists, and motorcyclists run a much higher risk of being involved in a traffic accident and consequently of being killed for each additional kilometer traveled than drivers and passengers of large vehicles. The audio is lost. I'm sorry. I'm sorry, we lost her.
Doctora Marisela, creo que ya se cortó la
I
comunicación.
think that we actually lost her. Could you please move on, Dr. Maricela? I think that we lost her.
Claro, claro, vamos a...
Yeah, sure.
Parece que sí.
Yes, indeed, we lost her. Well, she's in the other side of the world, actually. So she was mentioning that pedestrians, cyclists, and motorcyclists are always at a much higher risk of being involved in a traffic accident and consequently of dying for each additional kilometer traveled compared to drivers and passengers of large vehicles. According to the European Road Safety Council, the risk of losing one's life compared to that of a person traveling by car is 8 times higher for a cyclist, 9 times higher for a pedestrian, and 20 times higher for a motorcyclist. Similarly, males of any age are at a greater risk of being injured in a traffic accident than females of the same age, with the risk of death being 3 times higher for males than for females. These considerations justify the need to orient road safety policies based on data of the types of accidents and their characteristics, as well as knowledge of the circumstances in which they occur, the factors related to exposure to traffic with people, with the severity of the event and its consequences. We are grateful for the presence of outstanding professional experts on the subject matter. Dr. Ricardo Perez Núñez, advisor on road safety and prevention of unintentional injuries at PAHO WHO. Dr. Ileana Margot Rojas Medina, national responsible for surveillance of road traffic injuries at the National Center for Epidemiology, Prevention and Control of Diseases, CDC MINSA, and to all of you for your interest and support week after week, as has been mentioned since May many years ago. So thank you very much. Thank you very much, dear Dr. Malki. After these greetings of our Executive Secretary, after listening to Dr. Calle as well, I introduce myself. I'm Magda Hinojosa, Life Course Coordinator at Horas CONU, and today I will be in charge of moderating this webinar. After this preamble, to present the statistics of traffic accidents in the Andean countries, the causes, mortality, and disabilities that they originate, we give the most cordial welcome to Dr. Ileana Margot Rojas Medina, a psychologist by the Universidad Nacional Mayor de San Marcos of Peru, graduated from the Master of Mental Health in Populations by the Universidad Peruana Cayetano Heredia, with completed studies of basic and intermediate level of the field epidemiology program by the General Directorate of Epidemiology, now the National Center for Epidemiology, Prevention and Disease Control of the MINSA. She's currently nationally responsible for epidemiological surveillance of traffic injuries, the epidemiological surveillance of prioritized mental health problems, and epidemiological surveillance of family violence at the National Center for Epidemiology, Prevention and Control of Diseases of the Ministry of Health of Peru. With experience in conducting post-disaster mental health studies, and she's also the national coordinator of the GYTS Peru 2014 to 2019. So, dear Ileana, the floor is yours now. Thank you very much for this introduction. Thank you to the agreement for this invitation to share part of my experience in what I've been doing lately with regards to the injuries due to road accidents. I don't know if you can see my screen now. Yes, indeed, we can see it very clearly. We'll show it as a presentation. Okay, so as Dr. Calle mentioned a while ago, we have two international mandates around which we've been working for a long time now about the Sustainable Development Goals, which mandate is to reduce traffic accidents by 50%, deaths and injuries by trauma in the first 10-year period. We've started a second 10-year period in action for road security, which is actually the goal, to reduce these deaths due to traffic accidents by 50%. The figures, we will see those figures now, and we need to acknowledge that road accidents are actually a very big problem which affects the low to middle income countries like where we live by presenting mortality rates which are higher compared to the high income countries. The best indicator that we can use to make this problem visible, this problem generated by injuries due to traffic accidents, is mortality, actually. We can see here in this graph how, despite the people in our Andean countries account for 60.2%, with regards to high-income countries, 38.7%, the deaths caused by traffic accidents for low to medium countries is almost 70%, while in the other countries is 29%. However, in our countries is lower because high-income countries have a big fleet. However, the deaths in high-income countries is much lower with regards to our countries. Some literature mentions that if the number of cars grows, the mortality will increase as well due to traffic accidents. Well, and this is not the case if we take a look at this graph. So it is necessary, though, to work around certain interventions regarding traffic accidents. The estimated rate of mortality caused by traffic accidents per 100,000 inhabitants in our region, and we can see that here. The regional rate is 15.6% per 100,000 inhabitants. However, we see that in the Andean countries where we are located in the world, the rate overcomes the regional rate with 20.9 deaths per 100,000 inhabitants. And same thing with the Caribbean, with the Latin Caribbean countries. In Mesoamerica and the non-Latin Caribbean, it's slightly higher than the regional rate. And North America, of course, has a mortality rate which goes quite below the regional rate estimated for the region of the Americas. In the last publication of PAHO of 2019, with data from 2016, we have worked in the last road safety survey and Peru has been part of this survey as well. I assume that the outcomes will be ready by the end of the year and the publication will be ready next year. If we refer to the Andean countries and we take a look at the Americas per country, we will find a rate per country. I think that Venezuela has one of the highest rates in the Americas regarding mortality caused by traffic accidents, followed by Ecuador with a 21.3% rate, 21.3% for 100,000, Colombia 18.5, Bolivia 15.5 per 100,000 inhabitants, and Peru 13.5. We have Uruguay, Mexico, Chile with much lower rates compared to this regional rate estimated. These deaths stem from these crashes, and this is dependent on the type of victims. The users are grouped in drivers, 2 to 3 wheel vehicles, linear motorcycles, for instance, and motor cars and motorcabs that are present in almost all of the countries of our region, especially in the Andean region that belong to the agreement. And this is turning into a progressive problem that needs and deserves more attention, especially linear motorcycles. Cyclists also, as Dr. Kaya mentioned, this is also increasing. The number of cyclists is going up because the cycling ways are being promoted to improve physical health and greenhouse gas emissions and pollutants, and they use these means of transportation. Well, sometimes they are not part of the statistics of the morbidity related to traffic accidents because the lesions in pedestrians and cyclists are normally fatal, considering that we have not controlled the excess speed of the vehicles. The cyclists and the pedestrians sometimes are found in a lower proportion as part of our statistics. This graph shows how we are doing regarding these deaths per type of user. So within the Andean area, 54.6% comes within. It's almost half if we compare this to data of other users. If we speak about mortality, 7.2%, and four-wheel vehicles, 21.7%, in 2 to 3 wheel vehicles, as well as cyclists, which account for 2.1%. And, well, pedestrians, we have heavy-duty vehicle dwellers. And, well, I was kind of worried about this graph because if it's true, each one of the participating countries has agencies that are complying and collecting information. This is not being reflected as in this graph. In the non-Latin Caribbean, North America, which have more precise info regarding the statistics of deaths by users. We have a lot of under registry, if you will, in our mortality registries, considering those countries that are part of the agreement. So we need to collect more information from each sector that is involved. We have to consider health, transportation, the national police force. All of the sectors are actually involved in this, and we have to discuss health anyway. All of us should be concerned about having better information that will collect the statistics on the number of accidents and, of course, relating to the number of deaths that are happening. What is happening in our region, by the way? So here is the data in the Andean community, and precisely we can see how are accidents happening in our countries, bearing in mind the geographical structure of our countries, which is actually very complicated. Our geographies are very complicated as well. We have the coast, the highlands, the jungle, and traffic accidents have also different characteristics if we take the different regions. The automotive fleet is different because if we have accidents in the coast, it has to do more with buses and linear motorcycles and motor cabs, and they are mostly happening in urban areas. There's a bullish trend for each country represented in this graph. We speak about Bolivia with an increase of 11.9% from 2020 to 2021, Colombia, and you can see the numbers here as well. There's a big difference between these types of accidents in the urban areas and compared to the rural areas. It's actually a variation of 25.8% from 2020 and 2021, and Peru with a variation of 30.2%. This data speak for themselves, for us who work on this sector, just by taking a look at the numbers. If we had to take a look at the number of injuries per traffic accident, we can find that here in Peru, in the jungle, traffic accidents happen more in the roads where the traffic structure is different than the Pan American highway. The balance is much different if we consider the coast and we compare this with the highland, for instance. The accidents are massive in the rural settings. The accidents and the injured might include 7 to 81 people. The hospital care is complicated, which increases the risk of dying or aggravating the injuries of these people who suffer traffic accidents. And this is even worse in the rural areas. We have health establishments everywhere which might respond to an accident, but there will always be differences, of course, in the quality of care and the time that it takes to get to a center where to receive effective care. So how's the statistics in the countries of the agreement of ORAS? It is therefore very important to share experiences between the transportation agencies, health agencies, those who deal with the control of traffic, the national police. I think that we all have some road security agencies. In Peru, we have already implemented a national observatory where all the sectors are taking part in, we are trying to unify data. We are trying to have more information that will allow us to consolidate information at the national level, something that will be handy to implement specific interventions. And hence, we are also involving the local governments here in the country. In 2013, there was a plan implemented for municipal incentives. The goal of this municipal implementation plan in working with the local authorities, I'm not sure if the the C type was included, where the goal was to identify the black dots, and it was good. Maybe in 2016, there was a second goal of establishing low-cost interventions in these black dots identified, so that the local governments would be involved. You know that the interventions will be more effective if they are monitored and assessed by the local governments. And that means that they should have a budget for this, to comply with these goals. I mentioned this because if we observe that the figures with 2016 figures, the road safety figures as at 2021, we are showing the same figures. There's no reduction of mortality due to road accidents and injuries, and let alone the disabilities. We have certain difficulties to obtain this information vis-a-vis the disabilities. It is just a matter of carrying out a more thorough search. This has to do with issues related to insurance, which sometimes hinder the obtention of information. And the accidents in urban areas and rural areas, this is 15.7%, almost 16, and in urban areas, it's 84.3%. I was precisely referring to this when I mentioned these interventions to reduce these incidents or traffic accidents in urban areas, where there are all kinds of vehicles, from two-wheel vehicles, bicycles, motor cars, that are using urban highways, and they are competing with buses, with trucks, cargo vehicles, with this comparison. And it is a big concern to reduce these statistics in our countries, where case studies are almost similar. For Peru, 6.7, 93.3% in the urban areas. Ecuador, same thing, 63% in urban areas and 37% in rural areas. Same thing happens with Colombia with these numbers, and 83% in urban areas, and same thing happens with Bolivia. These accidents, of course, generate deaths, as I mentioned a while ago. In this graph, we can see the number of injured and death in the Andean community countries. And then this is something which has been stable. There's no trend towards diminishing. It's almost similar year in and year out. That includes the number of injured, the number of deaths towards 2020 because of this social confinement that we had because of the pandemic. There's a drop, significant drop because of this confinement, because vehicles were restricted and the non-registration of accidents, since the priority then was registering COVID-19 incidents. In 2021, things got better. And here we can see, if we carried out an analysis of Peru only, it's almost similar. So the number of deaths has not varied that much. However, in 2021, we have 13,000 something deaths for car accidents, due to car accidents, and 102,500 almost injured. We hope that we will either be keeping a stable number or a more reduced number of these accidents. Who are affected by these traffic events? I presented a graph from a study that was carried out here at the Epidemiology Center, and that was as at 2015. Traffic accidents, this is quite democratic. It affects everyone. There's no distinction compared to chronic diseases, cancer, diabetes, and so on and so forth. In traffic accidents, we are all equal. We are all victims of this scourge, irrespective of our age. As a child, for this year, we have traffic accidents, but in the teenagers from 12 to 17, this is actually the first cause of accidents and death. And we have, well, homicides, which is also something that we need to tackle, the issue of violence, and as adults. In these age groups, as a first cause of death, we have traffic accidents. In fact, all the affected people are within the labor age. I prepared this table with data from a publication of the National Police regarding the causes of car accidents in Peru. I have built this table for other years, and there has not been much variation. We are not moving our numbers down, so we can comply with these objectives that we have established. Dr. Calle said that we talk about accidents, but these are not accidents. If we group the causes of traffic accidents just for 1 year, considering the human factor, the percentage is very high. You can see that number here. This is a social cause. So it is all about preventing traffic accidents. Maybe there are different causes like alcoholism, speed, and other factors which might be listed as causes regarding humans. Issues with vehicles, with the road, and you can see the numbers directly. And also there's something regarding the environment. And in 10.6%, the cause has not been detected. It is necessary to work in an articulated manner. Sometimes there are traffic accidents and there's no filing of the accident, and it is much harder to identify the causes of these accidents. There's a 14.8% in other causes. So we have to pay attention to this table. We need to provide education since preschool. We have to work with all the users of the roads, cyclists, pedestrians, and four-wheel drivers. And we need to know that if we add and join efforts, I think and I hope that we have reduced a good percentage of these injuries and deaths due to car accidents. Well, we still have certain things to overcome for 2016. In the publication of PAHO, the last road safety survey that was carried out last year, well, I hope that we have improved these indicators. We still have the challenge of improving in terms of the use of the security belt. Bolivia has a 20.8% in terms of using the belt, and there's 3.5% here. Colombia, 75%, and in the front row, well, this is actually showing that there's some degree of improvement in the use of the safety belt, and it will be very useful in case of accident. And you can see the numbers that correspond to the different countries. In Peru, it's 58% approximately for drivers, and the co-pilot 15 something percent. We have to improve in terms of these numbers, and we have found information for Bolivia. Well, we haven't found information for Bolivia, and these are good numbers for other countries. In Peru, it's less than 1%. As I mentioned sometimes, when I give presentations, it's a cell phone is even more expensive than a car seat for a baby or a booster. So we have to think about it very, very seriously. The deaths due to injuries related to alcohol, 6.4% in Bolivia, Ecuador, 6.8%, and Peru, 9.3%. This is something that we have to work on, the consumption of alcohol in our regions, especially associated to car or traffic accidents. There are many interventions which are being taken by local governments in Lima, and interventions which have not been evaluated, maybe something that, well, we have some time restrictions in the sale of alcohol. Another indicator that we have to improve is the use of a helmet for motorcyclists. The percentage in the use of helmets in Bolivia is 51.9%. In the one of the co-pilot is 3%. In Colombia, 96% and 79.8% in the passenger. We know that Colombia has indeed very good interventions which have been applied and also evaluated that we can implement also depending on how we might be able to adapt them to our own realities. 90% Ecuador, and the passenger Peru, and 7.7% the passengers. This is actually a big problem. The use of helmets is already an indicator, but the increase of the automotive fleet of linear motorcycles is very, very high. We very seldom saw motorcycles, but now we see them all the time, all the time. And this is in turn a very deep concern of those of us who work in setting out more specific rules. I don't know if the penalties or sanctions will prove to be positive. It is just a matter of working around them. There are countries who already have this problem and are doing a better work with better results. I think that the only way to learn is from working in collaboration. Actually, these are the challenges to improve. These are the figures to improve as countries that belong to the agreement. And we need to work specifically in improving our registries, hospital records, and our pre-hospital care registries. This is something else. In Peru, we have implemented the SAMU, the urgency system, but by way of the epidemiological surveillance system, considering who transports the people who have had an accident, this transportation through an ambulance was positioned in the third place. I think that this has proven to be very positive. We have not evaluated this as we should, while this pre-hospital program is being implemented in different regions, and we hope that we will be able to evaluate this in the short term. I allowed myself to include a slide with data that will help us define a little bit more about the data where we have also added some trends to measure. We can see the data and we can establish differences among regions. We can see when they happen, at what time they happen, also including different age groups of injured people who come to our health services. And it's very difficult for them to comply with this regulatory document, but since we have implemented the interoperability of the systems, it might work much better. However, the information that we collect allows us to characterize these lesions due to traffic accidents and hand these to the corresponding agencies. We can see the main diagnosis, and well, you can see, I wanted to share this with you. I think that this is the last slide, and thank you very much for the opportunity. I hope I have complied with the goal of this presentation, that is sharing the statistics that we have as countries belonging to the agreement. Well, thank you very much, Dr. Ileana Rojas Medina, for your very interesting presentation, who has presented about the importance of recognizing traffic accidents as a priority and a public health problem, even more so in low to middle income countries, as our countries are in the Andean region, that are showing that there are higher rates in comparison with high income countries. So you have shown that in the countries of the Caribbean and the Andean region, we can get to 21 in average percent compared to 11.7 in North America. No doubt that we have very important objectives to comply with, and we need to reduce the number of traumatism. And you have also mentioned that from the total of number of deaths reported due to traffic accidents in the Andean region, 21.7 are happening in 2 to 3 wheel motor vehicles. There's a greater risk for those accidents, and this is followed by pedestrians.
Norteamérica, ¿no? Donde el
unlike North
74%
America, where
son conductores
64% happens with
de vehículos de 4 ruedas.
four-wheel vehicles. It is important to highlight that despite the automotive park is much greater in high-income countries, if we compare the mortality due to car accidents has a very high incidence, and it is alarming to see how deaths in users and cyclists has also increased a great deal. You have also expressed that the under-registration that we have in our countries is also a big matter of concern, and how we have to work, better work to improve the information, the data, and better recognize the causes and also intervene with more precision. Well, the figures that you have mentioned are also quite interesting. They have already increased. The ratio has been changing, and now the number of injured is much greater. And you also mentioned that there's, well, it affects all ages. However, this is even greater in teens and adolescents. It is the first cause of mortality. And finally, you mentioned how important it is to work in coordination, because all the sectors have something to do and work on, like working with the local governments, the education sector, apart from the infrastructure, as well as other sectors that are equally important. You mentioned that there are important challenges as use of the security belt and the percentage of children using car seats, the problem with alcohol consumption, the use of helmets. Dear Dr. Rojas, once again, thank you very much for this excellent presentation. You are invited to stay in the room, since at the end of these two presentations, we will establish a dialogue from the questions that the audience will ask. Thank you very much for your participation. Very well then, now to discuss the challenges of the new measures and the pending agenda, we welcome Dr. Ricardo Pérez Núñez, advisor on prevention of non-intentional lesions or injuries at PAHO WHO. Dr. Pérez Núñez is a doctor in science, public health, and since 2004 to 2021, he was a researcher in terms of prevention and control of non-intentional injuries and the promotion of road safety at the National Institute of Public Health in Mexico. Since 2014 to 2018, he served as the director on prevention of lesions for the prevention of accidents in Mexico. As of October 2021, he is the regional advisor of road security and non-intentional lesion injury prevention at PAHO, Washington. Today, Dr. Pérez Núñez will present on the challenges that we have to tackle and our pending agenda. So, Dr. Ricardo Pérez Núñez, the floor is yours. I would like to thank the executive secretariat of this, and especially Dr. Magda Hinojosa, who's responsible for the opportunity that you're giving me to share our reflections on the pending agenda and the challenges that we are facing now. Throughout my presentation, I would like to tackle 3 big challenges. I know they are not the only ones, but I think they are equally important. The big challenge is the magnitude of this problem and those elements which are necessary to promote safe traffic, which means to change the traditional vision in terms of how we understand the problem and seek a solution. Also, joining efforts among different actors from different sectors to actually create synergies that will help create evidence-based solutions. I would like to take some time to discuss how these traffic accidents are occurring in our countries. In a country without legislative or without the right laws, someone who's alcoholic and crashes, then the driver is expelled from the car. They were not wearing the safety belts, so they die. When we think about why this did happen, we realize that there are different possible causes and that there are elements to believe that if we remove some of them from the equation, this death could have been avoided. The situation that I'm presenting is not the exception. The lesions, the injuries are caused by different reasons. The good news, though, is that if there are many causes, there are many potential solutions. And this is the rationale that underlies the perspective that PAHO and WHO has been promoted for more than 2 decades. In a safe road, this would have been prevented, and the long-term vision is that nothing happens in the road transportation system. I wanted to tackle on building a system that will avoid these accidents, but if they happen, whenever the injuries are serious, the people should deserve a timely care to avoid unnecessary deaths and injuries. There are 4 ruling principles, governing principles. The first one is understand, but also accepting that people make mistakes all the time, that these mistakes might be resulting or might result in traffic accidents, and the human body has a limited capacity to withstand the consequences of an accident. And if we go beyond this threshold, the people will suffer from lesions and accidents. And the third principle is that people have a clear responsibility to respect the traffic laws, but even more so that there's a joint responsibility of those who manage and design the systems and use the motor vehicles to prevent these accidents from happening. And the last principle is that to multiply the effects of this system, it is necessary to combine all of these efforts so the people will be protected when something fails. But we have not moved enough. We have all heard that more than 1 million people die because of these accidents, and more than 50 million people suffer non-fatal injuries, some of them with a certain level of disability. And this has happened for almost the last 30 years. And if it's true this problem has not increased, and the number of vehicles has increased as well, this is not diminished despite all the efforts which have been pushed for globally and regionally. The added info hides important characteristics, and some of them have been mentioned by Dr. Ileana. First, who are those mostly affected in the region of the Americas? And the last report showed that almost half of those who died are vulnerable users, pedestrians, cyclists, even when in 20% of the deaths at the regional level, we actually didn't know who the user was, and we have to better classify these injuries and the age groups. And there are important sub-regional differences. The percentage of cyclists or motorcyclists who die in the Latin Caribbean, 57%, more than twice of what we see at the regional level, while in North America, it's just one part of what we observe in the Caribbean. In Mesoamerica, it's almost triple, and most of the strategies are focused on improving the safety of automotive vehicle drivers, and it does not contemplate more vulnerable actors. Something that we also need to view is the difference, such big difference that there is among the different countries of the region. The risk of dying in Canada is 1/3 than the regional average. So the magnitude of this challenge is different, and each country faces a different challenge, which might be different in nature and in number. And the strategies might differ as well. The added figures also hide what happened with time. And in analyzing the mortality rates, we can see some countries which had made more progress. In Canada, one way or another, they've been reducing their mortality rate from a relatively low rate to an even lower. Trinidad and Tobago reverted a rate that was actually increasing, and it took it down by 54%. That was the only country which got to the first goal. Brazil reduced the mortality rate by 37% in its first 10 period of action. Paraguay established a bullish trend. It was very marked, like Ecuador, and countries are still having very high rates, but stabilizing these rates was also a key goal. Other more subtle reductions were observed in Colombia and in Mexico, and this shows that it is possible to make progress, but it is necessary, as Dr. Ileana mentioned, to better understand what these countries did to move forward and how they could increase these numbers. There are other countries which seem had some drawbacks in the past years, like Venezuela, Guatemala, and even Chile, where starting 2016, the mortality rate has been increasing, slightly increasing. It is also necessary to know what happened in these countries and why it happened. If we analyzed what happened in the region with a trend registered these past years, we can see how by 2025, we will already have a 4-point deficit in our rate per 100,000 inhabitants. And we now have the big challenge to accelerate our work, be more strategic in our efforts, keep on doing the same, and expect different results is not an option. The projections at the country level, at the Andean subregion, shows that except for Colombia, there would be a gap from what is expected and the estimated trend by 2025. So these are data estimated by 2025. The countries already have more real data, but it shows what might happen and how it is necessary to strengthen the actions to achieve the ambitious goals that we have set out. So this has led the countries to adopt a new vision to improve road safety around the world. Through this dissolution of 2020 in the UN Assembly, the countries embraced the challenge to intensify the actions in a second 10-year period where they propose to reduce by 50% the number of injuries and deaths because of road accidents. And the WHO has this challenge to prepare guidelines based on evidence and coordinate the technical cooperation work within the UN framework, something that we might do even better. The World Plan for this second period very clearly identifies what are the measures that work and what it's needed to apply this at all levels. And we have safe users, safe infrastructure, mass transportation, safe transportation, safer vehicles, and the way that we have dealt with road safety makes it explicit for governments that they need to be responsible for road safety, but also that we need to work around a more sustainable guideline. There are more examples where the civil society has played a very important role in different countries of the region. There are concrete examples in Argentina, Brazil, Colombia, Chile, and Uruguay. And a very recent case, that's Mexico, which thanks to the civil society, the first national law on sustainable mobility has been approved, so we can all contribute to this goal. The plan also integrates, and for the very first time, 5 big agendas which had worked in isolation. One of them has to do with climate change. Some other two have to work with the promotion of physical activity to control diseases and promote mental health. One related to social equality and active mobility in bicycles or walking is the point where all of these 5 priorities converge. And this is the best way to promote the health of the people and promote social equality with a gender perspective as well. The future that I think we should aspire in our cities and country is a reality now in London, where the transportation plan is entirely improving the health of people in London, and this refers to the way that these traffic systems have been planned. This reinforces what we mentioned before, that we need to consider the effects on the health of the people. The plan explains how different diseases might be prevented and how different health and quality of life indicators might be better off when there's sustainable and safe mobility being promoted. How can we promote active mobility when we have privileged private mobility for a lot of time of motorcycles and vehicles, thinking that the solution is just adding lanes and keep on saturating our roads? Well, very clearly, the increase went over the capacity of transportation systems. When you see these images, it is very difficult to understand how someone might be inserted here and how safe will it be. So not being able to guarantee their safety will be counterproductive, and this lack of options promotes the use of motorcycles that has turned into almost an epidemic, which is very difficult to control. So I think that by now we have all understood that extending the lanes is translated into more vehicles, motorcycles, more pollution, and more congestion, and these spaces are no longer used for other activities that should prevail. I'm sorry, but he's reading. So it is very clear when you analyze the two pictures to the right that one way or another, the space that it takes to move people in private vehicles compared to the space it takes to move people through a bus or public transportation. Well, the public transportation systems, the ride systems transport more people, and they are doing it more efficiently, more affordably, and safer, and they promote social equality in terms of guaranteeing opportunities for the people who have different mobility options. Facilitating multimodal transportation is also the starting point to establish optimal mobility to guarantee the safety and equal access to mobility, answering to the need and preferences of the population. There are more specific actions like the availability of parking spaces like for bicycles and private vehicles, like in bus stations and in the metro stations, which might promote the multimodal displacement of people. The planning and the use of the land is something that is even more relevant, from pushing for space recovery initiatives like recreational spaces on the weekend, or doing this more permanently when closing ways where a lot of people concentrate, and this is something that will make the local economy better. The long-term look should be to push for better spaces and a better and harmonious use of the transportation ways that might invite people to walk or use the bicycle in a safe manner. And this applies to traffic and crime, and these are requirements which are important to foster multimodal transportation. So this depends on the different strategies that are created for society. This hierarchy refers to the investment in public spaces, and it should prioritize vulnerable users, and a kind and equitable city protects and prioritizes vulnerable people, and it puts them in the core of the decision-making processes. The current scenario is more than suitable to advance. The commitment of the countries to advance has been ratified in the past 20 years. There's not even one country that disagrees with improving the road safety in the populations. The high-level meeting of the UN Assembly had a very good level of consensus last year, with a renewed commitment from all the countries. This meeting has been one of the few that tackles a specific problem, and this contributes to promote leadership of the different stakeholders. There was active participation of the ministers of transportation of Argentina, Public Works of the Dominican Republic, the Vice Minister of Transportation of El Salvador, Chile, Paraguay, Brazil, Suriname, as well as representatives of Bolivia, Colombia. He's naming all the countries. And well, several others were present one way or another at this high-level meeting. As a result, this meeting, this high-level meeting, well, the countries adopted a political declaration where they sustained and sound commitment was ratified. This is actually another instrument that we have to manage and continue to push sustained mobility in the countries of our region. At PAHO, WHO, we have generated a big number of technical tools which have strived to foster an agenda that will promote. He's going way too fast. I'm sorry. This information is free on the internet. It is public, and if you consider it's useful, we will hand it to you. Last week, we had the 7th week of the UN for road safety, as something mentioned before. From PAHO, we have organized a webinar that is Rethinking Mobility in Latin America and the Caribbean. And throughout this webinar, we had the chance to disseminate the important work that is promoted locally, and also local examples like the example in Dominican Republic and Paraguay, where they made important strides, and also the experience in Buenos Aires and Fortaleza, cities that have shown that local, well-articulated leadership can be very effective. And before, as PAHO, we've been compiling other examples of good practices in the region with different contexts and examples. But all of this allows us to see that it is actually possible to move forward. It isn't easy, but we can do this. Apart from the approach, it is also necessary to work in areas where we have made little progress in the region. One of these is the safety of vehicles, so that optimal standards won't be just considered as luxury. It should be a requirement from the regulatory standpoint. And from the very moment they are sold, these insurances and safety devices should be used from the very beginning. Colombia, I think that as a pioneer, it is the first Latin American country that adheres to the 1958 Agreement on Vehicular Safety. And we have the hope that many other countries will use these other instruments of the UN to strengthen their local regulations. Something else we are working at PAHO is to strengthen care in emergencies. We know that it is cost-effective to reduce the number of deaths and disabilities. This is why it is an essential element that was brought on from the very beginning. And we've been making progress in the region through the generation of technical instruments to foster this work in the different countries. Like in this publication where we launched this last week. It's accessible for consultation. It highlights the need to perform a system diagnosis to identify the gaps and actions that we might take jointly. This publication, well, of course, we will try to make it, to share this. Right now, I'm in Paraguay, and last Monday, the national agency of this country make the results of the evaluation it carried out known. We've been working on this for some years, and we are now working on implementing these measures through the capacity building and training of professionals to make sure that everything will be of a very good quality to prevent unnecessary deaths. This is also something that we can do in other countries, and we could contact the different PAHO offices at the different countries, and by showing your interest, we might start working in advancing the attention to emergencies. So with this, I would like to conclude my participation. I thank you very much for inviting me, and I will be here. Well, if you have questions, just let me know.
Muchísimas gracias, doctor.
Thank you very much, Dr. Ricardo Pérez Núñez, for your very thorough presentation. And you have explained the big challenges that we have. Actually, three important challenges. One, working on this important number of traffic accidents and that we have in the region, and how we need to look for elements to gain safety mobility or safe mobility. And the other traditional approach to the problem and find more concrete and realistic solutions. And also you have expressed that we need to join efforts and coordinate efforts with those actors who are involved to be able to reach a certain level of synergy and improving the rates. So these are sometimes accidents which have been prevented. And you say that these accidents happen due to different reasons. It's not just one cause of accident. And therefore, there are multiple solutions that we have to consider. This is why you say that the World Health Organization and the Pan American Health Organization has this look towards intervening the multiple causes, because we shouldn't accept this big number of injuries and deaths due to the traffic accidents. You mentioned the basic governing principles, understanding that there is the possibility of incurring in a mistake, that there's shared responsibility, not only from the governments, but the users, and that all the parts of the system should be strengthened to simultaneously and in a combined way avoid these problems. In the Americas, half of those who died are vulnerable users, pedestrians, cyclists, and motorcyclists. You've given examples like in Canada, where from 2000, there has been an important reduction in the mortality numbers. In Trinidad and Tobago, same thing. And you have also highlighted that we need to analyze what these countries did to reach the same level of improvement elsewhere. This shows that we need to recognize the problem better and act accordingly in coordination with all the stakeholders. You have mentioned the action plan, and you've given concrete examples. And you also say that there are 5 agendas that have been prioritized. They were tackled in isolation before, and how we act in coordination. And in this way, we could reach better outcomes. And finally, the long-term look is also important. With a better use of spaces like bicycles. Unfortunately, in the Andean countries, we don't even have the structure, the necessary structure. Actually, the cities have not been designed for these uses, and we are normally not used to this. And cyclists and pedestrians should be our priorities in designing these public spaces, and we have to protect those who are more vulnerable and getting to having more equitable cities that will be the focus of our road safety measures. Thank you very much, Dr. Ricardo Perez Núñez. Thank you very much for your excellent presentation. We will start with the Q&A session shortly. After this time where we have shared our knowledge, it is fundamental to take a break and start a mini session of physical exercise. Horas Konu encourages the welfare of those who have joined us, and we will have an active pause to be healthy, combat stress, and keep our muscles flexible and healthy. So let's start our active break.
Buenos días, buenas tardes. Desde el Organismo Andino de Salud, Convenio Hipólito Unanue, estamos muy felices de invitarlos a esta actividad saludable. Hoy vamos a trabajar la agilidad, la velocidad, así que quiero que repitas junto a mí, ¿listo? Muéstrame tus dos manos al frente, perfecto. Cuando las tengas, repítalo y dígalo en voz alta. Manos, arriba, no te escuché, dígalo, arriba, eso, abajo, izquierda, derecha, al frente, atrás, arriba, abajo, izquierda, derecha, atrás, al frente. Perfecto, lo tienes. Llegó el momento de la agilidad, la coordinación y la velocidad. El movimiento que yo diga, tú haces el movimiento contrario y lo dices en voz alta, ¿listo? Entonces si te digo arriba, ¿tú qué dices? Abajo, ¿sí o no? Abajo, perfecto. Izquierda, ¿qué sigue? Derecha, perfecto. Al frente, atrás, al frente, abajo, izquierda, domínalo. Derecha, el que se equivoque gasta un refrigerio para todos, ¿listo? Bueno, nos fuimos arriba, abajo, izquierda, derecha, al frente, atrás, paso a la izquierda. ¿Para dónde vas? Para la derecha, ¿sí o no? Paso a la derecha, perfecto, paso al frente. ¿Para dónde vas? Paso atrás, arriba, velocidad, abajo, izquierda, derecha, paso a la izquierda, paso a la derecha, paso a la derecha. Paso a la izquierda, paso atrás, ¿dónde estás? Paso adelante, perfecto, paso a la izquierda, perfecto, paso a la derecha. Oh, porque mi misión es confundirlo, mi misión es confundirlo y que tú estés coordinado, ágil, veloz, excelente. ¿Cómo está la gente de Bolivia, de Chile, de Colombia, de Ecuador, de Perú y Venezuela? Necesitamos los más ágiles del Horas Konu, ¿listo? Entonces, manos, arriba, ¿para dónde vas? Al contrario, ¿no? Arriba, abajo, izquierda, derecha, paso a la izquierda, paso a la derecha, paso al frente, paso atrás. ¿Qué tal si te digo brazo derecho? ¿Cuál subiste? ¿El izquierdo? Ah, bueno, brazo izquierdo, perfecto, codo izquierdo. ¿Dónde vas? ¿Dónde vas? Codo derecho, paso atrás. ¿Para dónde vas? Paso al frente, paso a la izquierda, paso a la derecha, atrás, adelante, arriba. ¿Dónde estás? Abajo, ojo, giro a la izquierda, giro a la izquierda. ¿Por dónde giraste? Ah, perfecto, giro a la derecha. ¿Para dónde giraste? ¿Para dónde giraste? Ojo porque mi misión es confundirlo. Lo tienes, brazos, brazos, brazos. Arriba, ¿para dónde vas? Vas para abajo, ¿no? Al contrario, abajo, perfecto. Ojo, izquierda, derecha, brazos al frente, abajo. Muy bien, izquierda, izquierda. Eso es, derecha, abajo, paso adelante. ¿Para dónde fuiste? Ay, no se deje confundir. Paso atrás, paso adelante, paso atrás. Eso, dilo en voz alta, voz alto. Brazos, brazos. Derecho, izquierdo, brazo derecho, brazo izquierdo. Ojo, rodilla derecha, rodilla derecha. ¿Cuál tocaste? ¿Cuál tocaste? Rodilla izquierda, rodilla izquierda. Giro a la derecha, perfecto. Giro a la izquierda, perfecto, lo tienes. Adelante, venga para adelante. ¿Para dónde se fue? ¿Para atrás? ¿Sí o no? Paso atrás, perfecto. Derecha, derecha, derecha. Ahí, izquierda, abajo, arriba. Paso adelante, paso atrás. No se deje confundir porque usted debe hacer los movimientos contrarios. ¿Listo? Última oportunidad. Velocidad, agilidad. Recuerda que lo que yo diga, Tú haces el movimiento contrario y lo dices en voz alta, ¿listo? ¡Ánimo, organismo andino de salud! Yo creo en ustedes, los valientes, los fuertes, los guerreros, las guerreras, todo, ¿listo? Manos, ojo, arriba, ¿para dónde vas? Eso es, abajo, muy bien, derecha, derecha, muy bien, izquierda, al frente, atrás, paso adelante, ¿para dónde vas? Ahí, paso atrás, paso al frente, paso atrás, giro izquierdo, ¿para dónde vas? Giro derecho, perfecto, brazo derecho arriba, ¿cuál subiste? Brazo izquierdo, al frente, rodilla derecha, codo izquierdo, oreja izquierda, oreja derecha. Ay, no se deje confundir que el profe le pone trampitas. Último, arriba, tú vas para abajo, ¿sí o no? Abajo, muy bien, izquierda, 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 derecha, paso al frente, paso atrás, giro izquierdo, muy bien, giro derecho, ojo, pierna derecha, ahí sí es la derecha, ojo, ahí, domínelo, pierna izquierda, ahí, la contraria, si es la derecha, giro izquierdo, muy bien, brazos arriba, brazos abajo, perfecto, izquierda, derecha, al frente, atrás, y te das un fuerte aplauso, muy bien, ¿cómo te fue? Coordinados, veloces, ágiles y demás. Bueno, recuerda que estas pausas activas son momentos de recuperación físicos, mentales, emocionales, para favorecer un estilo de vida saludable. Desde Loras Como estamos muy felices de que desarrollen estas actividades con nosotros y los motivamos a seguir llevando un estilo de vida saludable. Y nos vemos pronto. Chao, chao.
Bien, luego de nuestra
Well,
pausa activa,
after our active break, we would like to thank all of the people who are here from the ministries of health, the academia, and different social organizations from Argentina, Bolivia, Chile, Colombia, Cuba, Ecuador, Spain, Guatemala, El Salvador, Mexico, Nicaragua, Paraguay, Peru, Uruguay, Venezuela, among others. We have received greetings and very interesting comments from our participants. Well, thank you very much to you all. To start this dialogue, stemming from the questions which have been asked, I would like to ask all of you to turn your cameras on. Throughout this webinar, the participants have asked some questions, and now we will start answering most of these questions. This question is for Dr. Eliana Rojas. In the statistics, the number of deaths caused by traffic accidents, are they including the deaths which happen days after the accident? You are muted, doctor. I'm sorry. Well, yes, the definition is 30 days after. So yes, it includes this. So since they are alive, well, they might die some hours or days later, depending on the severity of their lesions. So yes, this is considered in the statistics, and the police registers some information regarding these accidents. They are in the PAHO publications. Well, I'm referring to Peru specifically, but yes, this is even 30 days after. Thank you very much, Dr. Ileana, for your reply. Question for Dr. Ricardo Perez. What risks does it entail, the growth of vehicles in Latin America and the Caribbean from 850 million in 2000 to more than 2 billion in 2016? Well, we saw the risk We have to pay attention to the way we have privileged private transportation. They can get to very high speeds, and it is also unsafe for the people that share the roads. And they even saturate. I mean, they are not in the capacity of absorbing this high number of vehicles. We have to rethink the way that we need to mobilize as a society to try to forward more efficient, safe systems with a lower impact on the environment. They need to be less dirty and reduce environmental pollution. And with this, we will be in a position to promote safer and sounder societies. I don't think we should bet for promoting everyone to have a bicycle or a motorcycle. Well, thank you very much, Dr. Perez Núñez, for your reply. Question for Dr. Ileana Rojas. According to the IDB, Bolivia and Peru are countries which have reduced their mortality rate due to accidents from 2015 to 2018 in the Andean region. What do you consider are the main factors that explain this? I've taken a look at the IDB World Bank info, and the trend might have decreased, but this is not quite significant. I think that indeed there would have been, well, there are interventions like good practices. In our countries, especially I'm referring to Peru, we have implemented interventions, but sometimes they are not being assessed. I was referring to experiences in Colombia vis-a-vis the issue of alcohol consumptions. Well, we have implemented these actions. They have reduced the mortality and violence somehow. And precisely, I don't have this number of traffic accidents, but once an intervention is assessed, we might then be in a position of saying that this is the reason for the intervention. I'm not familiarized with Bolivia's actions, but the interventions, if they are not evaluated, actually we don't know what it means. As I mentioned throughout my presentation, sometimes we have a lot of under-registration, and there are data from the National Police of Peru where in 2008 or 2010 has dropped, but this has not been explained, even not by the police. So I think that it is a matter of reviewing each experience one by one. Thank you, Dr. Ileana, for your answer. Question for Dr. Ricardo Perez Núñez. Apart from the unfortunate trauma and death, what is the impact that this system is having on the environmental health of the inhabitants in the region? The damage is very clear. I mean, it creates greenhouse gases, and this has been affecting the quality of the air that we breathe. This has damaged the population from different perspectives and has promoted secondary effects. And this is a clear evidence that this is not a model that we should bet on to try to promote the public health in a comprehensive manner. And of course, this goes hand in hand with other elements associated like waste from the automobiles and vehicles that help contaminate the environment. There's a lot of well, we need to change the way that we mobilize, and we need to promote our schemes that will work better. We used to walk a lot. In Latin America, we used bicycles a lot. And then with the creation and invention of the vehicles, everything changed. The way that we move as a society has changed a great deal. So I think that we should move now towards towards safer and more secure transportation means. Question for Dr. Rojas. In Chile, Colombia, and Ecuador, there's evidence of greater rates of mortality due to traffic accidents in cyclists in the Andean region. What is peculiar in these cities? What do you think about these types of accidents? I believe that if we take a look at the statistics, this is part of a health registry. These traffic accidents are, well, Chile has a very interesting information system, not only referring to health, but the other sectors as well. Did you mention Ecuador? I'm not sure. Well, yes. When we see the cyclists being part of our statistics, this means that our strategies are not working. They can even go to a health post, and this is another way of having information available. You mentioned pedestrians and cyclists as well. If there's a car crash, it all depends on the speed of our drivers. This is not something that you can see in the registry, but you can see this in the death registry. I think that this is the reason because it is complicated to have information where we can have more details about this. Well, Dr. Ricardo has mentioned the vulnerability of these users. If we don't have information as victims, it is because they are already included in the mortality data. Thank you very much, Dr. Eliana, for your response. Dr. Perez Núñez, what examples of sustained actions in favor of road security are important in our region? What are your projections and how to promote scalability? Well, thank you very much. Something that I was referring to in my presentation is the work that has been promoted in cities as Fortaleza, Salvador de Bahia in Brazil, and both cities, the work promoted in Buenos Aires. And we have identified many other cities that are here to promote road safety from another perspective, from another lens. It is necessary, as Dr. Eliana mentioned, to compile, to collect data from the exposure to risky behaviors and the characteristics of the injuries and the accidents, why they happen, where they happen. And all of this should guide the decision-making about those elements that should be tackled comprehensively to reduce these accidents. So To build on the previous question about the need to assess what worked, it's the big challenge for researchers to separate the effects coming from these comprehensive packages, because they are tackling vehicles on the one hand, the road infrastructure on the other hand, also the behaviors. There are changes being promoted, and all of this generates complications because we cannot separate the actions one by one. But very clearly, to me, the main message to give out is that there were very clear examples at the city level of different cities in the region where they've been betting for this more integrated systems approach, reinforced with evidence. And well, this is happening in all these different contexts, and building on the main recommendations that were mentioned in the World Plan. Well, somehow this promotes the reduction in the number of deaths and serious injuries and disabilities and so on and so forth. Yes, thank you very much. Yes. I was referring to Trinidad and Tobago. This has been successful there, and the work in different cities of Brazil affected national rates. And these are experiences that have given us important information, showing that it is necessary to have an in-depth discussion as to how we can guarantee safe mobility. Thank you very much for your answer, Doctor. Question for Dr. Eliana. The COVID-19 pandemic, has it had effects on road safety in the region? I was showing one of the slides in my presentation where the statistics of traffic accidents, well, have been stable. There was no significant drop in the number of deaths or events or injured. In 2020, stemming from April on, you can tell that there's a reduction. If we only refer to the monthly registries, there's of course a drop, that's true, in April. But then the reduction is important if we compare this to the previous years and with the 2021 and 2022. There were restrictions throughout the pandemic. We know about that. Public transportation prevailed throughout the pandemic. However, an effect of this restriction there were traffic accidents, and they were occurring anyway. The hospital registries were not so specific. I've not known further experiences with a positive impact. We have reduced the number of deaths and injured and the number of events, but it was because of these confinement measures. Thank you very much, Dr. Ileana. One last question for Dr. Perez Nunez, please. What strategies with a gender approach can you propose to reduce the number of road accidents, since it's 73% of all deaths caused by accidents in 2018 affected men less than 25 years of age, meaning that men have a higher mortality rate that's 4 to 5 times higher than women.
Claramente, como sociedades tenemos
As a society, we have outstanding work in building the gender identity and masculinity, as has been built in our countries, assumes that there is a need for males to adopt riskier behaviors. This has not helped in their exposure. And then the gender role affects them, since they are greatly exposed to environments which are riskier for them. They have to leave their houses and they have to mobilize, and this affects their health when this is not done in safe conditions. But there's also something that we need to consider with the gender perspective. We need to guarantee that the roads are safe, that public transportation needs to guarantee their safety, needs to protect women, the elderly, and children. They need to have active alternatives that won't add hazards to these populations. So gender is important regarding different elements that we have to work around. There are even communication campaigns, social communication campaigns, which refer to the emphasis when men drive a motor vehicle and the woman beside, and if the man drinks, he will put everyone at risk. And women play a very important role here, because they can say, no, I won't jump into that car because this person has drunk. So I think it is about empowering women even more, so that they won't be exposed to unnecessary risks which are inherent to the chauvinist alternatives that have been applied so far in terms of the interventions that were applied. And this is something that has to be considered anyway, to guarantee road safety with a gender perspective for both genders, not only men or women. Well, thank you very much, Dr. Perez Núñez. We would like to thank all of you for the questions asked. We actually didn't have time to answer them all, but we will consider them to define the issues of our next webinars. We value your interest and participation. And to close this space, I would like to ask our two speakers to give a last 1-minute message. Dr. Ileana, the floor is yours. Yes, thank you very much. I mentioned this during my presentation. The road safety issue is something that concerns us all, from the viewpoint of users, pedestrians, cyclists, vehicle drivers, truck drivers. It involves not only the health sector, because it needs to look after all of those victims, but other sectors as well. The business sector, communications agencies, the civil society, the state's agencies, justice, education. The road security is part of us all, And with this, I think that we will be able to modify these statistics that we need to improve despite all of our efforts. Thank you, Ileana. Dr. Pérez Núñez, the floor is yours. Well, I would like to thank all of you for this privilege that I had being here with you. I would like to highlight the interest of PAHO of supporting the different states in the Andean region, but also in the other regions of the world, in all of their local efforts for protecting their people with new initiatives, sustainable and safer initiatives, because the long-term effect of all of this is to improve the physical health, the mental health of the populations, and social equality, which is much needed. We've worked on emergencies throughout the pandemic, and this is the first care level, the necessary levels that we need to strengthen. And this could be an effective strategy to reduce the number of people who die in accidents. Once again, I would like to reiterate my intention to support you in everything that you need. Thank you, Dr. Pérez Núñez. Thank you very much to all of you for your attention, for your presentations and our social network. We've had very positive comments, and Dr. Ricardo Pérez Núñez, thank you. Thank you all. The Loras CONU team and all the people who've taken part in this activity, which has been possible thanks to the commitment of all of our countries. Finally, I would like to hand the mic to Dr. Marisela Malki, Assistant Secretary of Loras CONU, for the closing words. Dr. Malki. Thank you very much. Well, first of all, I would like to very especially thank our two excellent speakers, Dr. Ricardo Pérez and Ileana Rojas, for sharing your time with us. And we've been told that trauma caused by traffic accidents is one of the main causes of disability and death. And WHO makes reference to the high number of people who die. And this happens in all age groups. This is the main cause of death, affecting teenagers and adults mostly, and the labor force. And this definitely means that, unfortunately, throughout all of this time, so far we have not moved these statistics, which have been repeated every year, even making them worse. However, this might be prevented if we act upon the triggers. And one of the triggers is the human factor, which is more than 60% of all the cases associated to unsafe behaviors of users of the roads by driving and exceeding the speed, or even as pedestrians. Unfortunately, traffic accidents are still a public health priority, even more so in low to middle income countries, where there's the highest mortality compared to high income countries. Despite our commitment with the SDGs to reduce both the injuries and deaths by 50%. Actually, Trinidad and Tobago is close. Well, it has actually reached this commitment. Being this such a big and important problem with different causes, there is also a possibility to finding different solutions with the participation of different sectors and disciplines. So we should have a multi-systemic approach and a shared responsibility. You mentioned the possibility of working on mental health, climate change, uncommunicable diseases, and other issues which might be worked all together. It is necessary to work around a multimodal transportation approach, improving public spaces and working around the planning and zoning. Well, in our countries, we should put pedestrians first, then cyclists, then public transportation, and the motorcyclists would come in the end. And what we see in our countries and cities is all the opposite. It is necessary to rethink mobility in Latin America. We've made reference to good practices, and we've heard about experiences in London, in Canada, in different cities of the world, in Brazil, and this should be motivating us to change. If there's political will, if there's participation from all the different sectors, I think that this is something possible. We might get there eventually. And while we still have these spaces where we can all continue discussing this, I think that we will be successful. The civil society, everyone should be paying attention to complying our role. Once again, I would like to thank our presenters, also the participants and those who are listening from different parts of the world who are joining us week in, week out, who encourage us to continue with these learning spaces. And remember that next Thursday, June 1st, we'll have a presentation on critical epidemiology on SARS-CoV-2 in Latin America and the Caribbean, which is something which we cannot forget still. So with this, we'll keep promoting the discussion around health, which should be on the spotlight all the time. I would like to thank the whole team. Thank you very much. Until next week.